Good morning. My name is Dr. Matthew Burns. Today's topic can be anxiety-provoking for a lot of people, but it is something I am also very passionate about. The topic is screening colonoscopy. I hope this video educates you as well as relieves some of the anxiety that you may have about the procedure. You may have heard of colonoscopies and even asked yourself the question, should I have a colonoscopy? That leads to several questions. Is it really necessary? Will it hurt? Will it be embarrassing? And what if they find something? Those are all great questions, and all told, colonoscopy, properly conducted, can save lives. Most people are aware that a colonoscopy looks at the inside of your colon, but don't necessarily have a lot of details about the rest of the procedure. During the course of this video, we will go over the who, the what, the why, the how, and the where of colonoscopy. So who should undergo colonoscopy? It's actually a lot more people than you might think. It's not just a rare occurrence. It might be that person, or that person, or that person over there. In fact, nearly everybody should undergo a colonoscopy at least once in their life, and most people should undergo multiple colonoscopies. Now, most people are aware that women should undergo mammograms and pap smears as part of preventative health maintenance. Similarly, nearly everybody should undergo colonoscopy also as part of preventative health maintenance. There are three broad reasons to conduct a colonoscopy: to screen, to survey, and to diagnose. The first category is screening, in other words, performing a colonoscopy on somebody who has no symptoms at all. The current guidelines suggest that everybody should undergo screening for colon cancer by the age of 50 and sometimes 45. While there are a variety of ways to screen for colon cancer, colonoscopy remains the gold standard. If the exam is completely normal, we then repeat that exam at 10-year intervals. If the exam has certain abnormalities to it, then it may need to be repeated in a shorter time frame that is to be discussed with your doctor. The second category of screening is people with a high family history, strong family history of colon cancer. People who have a first-degree relative with colon cancer, such as mom, dad, brother, or sister, should undergo a screening colonoscopy 10 years earlier than the age of that relative that had colon cancer. So for instance, if your mom had colon cancer at the age of 45, you should undergo a colonoscopy at the age of 35. The final category is people with certain genetic conditions or other medical conditions that make them at a much higher risk for colon cancer. They should undergo screening with colonoscopy much more frequently than the 10-year interval. The colon is basically a tube in the abdomen that runs around the outer edges of the abdomen. It is about 5 feet long, and it is this tubular structure that the colonoscope is inserted. Colon cancer, when it happens, can be described as either localized to the colon, spread to the lymph nodes, or spread to distant organs, and that has significant ramifications upon the prognosis. Colon cancer that is localized just to the colon itself is localized only within the colon wall and has spread nowhere else. However, colon cancer that is spread to the lymph nodes has escaped through the colon wall and into the lymph nodes adjacent to the colon. Distant spread can occur to other organs such as the liver, the lungs, or many other organs. The numbers I will present are averages, and individuals certainly deviate from averages all of the time. I am simply presenting these average numbers to give an indication as to why it is important to diagnose colon cancer earlier rather than later. On average, the 5-year survival rate of localized colon cancer is 90%. If, however, the lymph nodes are involved at the time of the initial operation, that number drops to 71%. And if there are metastases to distant organs, the 5-year survival drops to 14%. Now, I wish that nobody had colon cancer. But if you have it, it is much better to be diagnosed earlier in the course where it is easier to treat. Additionally, there is a preventative measure to colonoscopy. Colon cancers typically start off as small growths within the colon called polyps. These polyps then undergo a process called dysplasia, which eventually progresses towards what we call cancer. As a bonus, if we remove the polyp before it undergoes this process, we may prevent the cancerous process from ever starting, thus preventing cancer within the colon. Your colon needs to be clean and empty in order for me to be able to see well during the procedure. In order to accomplish this, we conduct what's called a bowel prep the day before the procedure. The day before the procedure, you can have a regular lunch and then nothing more than clear liquids the rest of the day. There are a variety of ways to accomplish a bowel prep, but the most common regimen that we use consists of Gatorade and Miralax, as well as with some Dulcolax. We'll go over that in just a moment. There are a variety of ways to time the medications for a bowel prep. The prep that we typically use starts the afternoon before the procedure, in which somebody takes 20 milligrams of Dulcolax orally. About an hour after that, they mix together a 238-gram bottle of Miralax with a 64-ounce bottle of Gatorade, and they drink 8 ounces at a time until the bottle is empty. It usually takes 2 or 3 hours for the bottle to be empty, and that usually will result in a good bowel prep. Now, there are some people that are intolerant of this and will have vomiting or abdominal pain, and there are some people that actually won't get cleaned out and have to have an additional bowel prep after this one. There are additional bowel prep regimens that can be done and additional timing regimens that can be completed, but this is the one that we usually offer. Well, the day of the procedure has finally arrived. You will be checked in by a nurse in the preoperative area who will review your medical history. She will also start an IV, which is a small tube and needle inserted into your vein. She will then check your vital signs. The anesthetist will also visit with you and craft the most appropriate sedation regimen. Your doctor will visit with you and answer any remaining questions you have. Now remember, it's okay to be nervous, but there is no need to worry. We will take good care of you. Okay, it's time to wheel you to the procedure room. So we have finally reached the procedure room. The anesthetist will be at the head of the bed, monitoring your vital signs, as well as providing supplemental oxygen as needed. We will then turn you on to your left side, and once you're in position, we'll provide sedation. We take great care to preserve your modesty during the procedure. The sedation is good enough that most people actually have no memory of the procedure whatsoever. Once you're sedated, I insert the scope into your bottom, which has a video camera and a light on the end of it, and I fish it all the way around your colon to look at the inside of your colon. If there's something to biopsy or a polyp to take out, I will right at the same time of the procedure. This is the basic appearance of the inside of the colon that we see during colonoscopy. As you can see, the inside of the colon is a tan pink color with some blood vessels that are visible on the surface. There are also some folds in the colon. We pass the scope the entire way through. The scope has a video camera as well as a light on the end of it, and we also insufflate air to distend the colon so that we can see on the inside. What that means is that you'll have a lot of extra gas in your colon at the end of the procedure, which you will pass out of your bottom in the post-procedure area. That is certainly nothing to be embarrassed about. We take a good look at the colon, both going in and going out, and also take great care to look behind the folds in the colon. Additionally, we suction out stool that we encounter so that we can see the wall of the colon very well. So what can we see during the colonoscopy? We can see a variety of things. By far the most common finding is that of a normal colon, and that's what we saw in the previous videos. We can also commonly see some abnormalities that are of no significant clinical issue at the time, such as diverticula, which are outpouchings of the colon. Many people have something called diverticulosis, and as long as those outpouchings don't get inflamed, it's of no real significant clinical consequence. Polyps are also fairly common, which are growths along the inside of the colon wall. We can remove those during colonoscopy to try and prevent them from turning into cancers. Sometimes the polyp has progressed far enough that it actually turns into a cancer as depicted in this picture. That's an entirely different discussion, typically requiring surgery. And finally, sometimes we can identify inflammation of the inside of the colon, known as colitis. This can lead to diarrhea or abdominal pain or fevers or other systemic issues. After the procedure, you will be wheeled to the post-procedure room where you will be monitored until your sedation wears off. We use a very fast-acting sedative, so you are awake within 30 minutes of the procedure ending, and frequently much faster. We will give you something to drink and some crackers to eat. When you are stable and awake, we will release you to home. Of course, you are going to need a driver. Even though you are awake, the sedative can impair your judgment, so it is not safe to drive for the rest of the day. Also, feel free to use this as an excuse to not do the dishes, mow the lawn, or cook any food for the rest of the day. There are some pitfalls to colonoscopy. There is about a 1 in 1,000 chance of putting a hole in the colon called perforation during the procedure, and that may require a big operation to fix. Additionally, there is some chance of stirring up some bleeding during the procedure, especially if a large polyp is removed. Most of the time we're able to get the scope the whole way through, but occasionally the scope won't reach the end of the colon and we have to do an alternate procedure in order to screen your colon, and that's typically what's called a barium enema. That's a procedure in which some contrast material is placed into your bottom and into your colon and an X-ray is taken. And finally, some people will not have a complete preparation with Dulcolax, Gatorade, and Miralax, and we have to use an alternate preparation on another time in order to get the colon cleaned out well enough to see. So that's the summary of colonoscopy. Hopefully your results were completely normal. If there was an abnormality, then we would have taken a biopsy and sent it to the pathologist to look at under a microscope. And once we had the results, we would call you and discuss the results with you. Regardless if the exam was completely normal, showed a polyp, showed inflammation, or showed a cancer, we would craft a treatment plan that is specifically dedicated towards you. I hope this video educated you as well as relieved some of the anxiety you may have had about the procedure. Nobody really looks forward to a colonoscopy, but the exam can be very important and could one day save your life. There are many skilled physicians that do colonoscopy. I work in an absolutely fantastic facility with wonderful people in Scott City, Kansas. If you ever want to see me in consultation for this or any other surgical issues, I can be found at the Scott County Hospital. I hope this has been informative and has reduced anxiety that you may have had about having a colonoscopy.
Not too far from the heart, there's a star.